This is a routine grade 2 nuclear sclerosis, and I'm just going to show how I routinely go about this case with Phaco. So here I'm placing a 2.8 millimeter incision, two side port incisions as well. I then fill the chamber with 2% HPMC, and you can see the pupil has dilated a bit with it as well. Then put in some 2% HPMC over the cornea as well. Or take my bent 26 gauge needle and fashion a 5.5 mm CCC, and it's going very well. Just center this around the central Purkinje image. And you can see with no sweat I have got it. It looks pretty good. I then decompress the chamber before doing my hydrodissection. And sometimes this can happen that hydrodissection wave has stopped. Don't continue, go to another area after decompressing and then do your hydrodissection. And here just rotating the nucleus, making sure that all the capsulocortical adhesions are severed. Then put in some HPMC. I've got a Sinski hook as my chopper in my left hand. Just aspirate the superficial cortex, and this should be fairly easy to do. So this is almost like a combination. This is a quick chop method, in fact, or some people call this the karate chop. My parameters are 40 ml flow rate, 400 millimeters of mercury vacuum. My Phaco power is just 40, and I'm in continuous mode. So just making my segmentation. This you have to be careful. There is only a central hardcore nucleus, so don't stray into the epinucleus. It will be difficult to chop them. And although you need only about 4 segments, I did a few more. Once that is done, I start removing the segments. Mind you, I have got the same parameters on. It's only when I go into aspiration mode for cortex that I change my parameters. All the parameters will be stepped down. So just removing all the segments, and that's done very easily. I then step down on my parameters. I am now at 250 millimeters of vacuum and around 15 to 20 ml AFR, 200 to 250 vacuum, linearly controlled. Now I am going to use the Phaco-tip itself to remove the cortex. And you can see patient is moving a bit, okay, but that's okay. I've probably kept her in an awkward position, so can't blame her. And that's easily removed. Cortex is done. There are a few fibers. I go into my posterior polishing mode, which is just 5 ml vacuum and 5 millimeters of mercury vacuum and 5 ml flow rate. I hope you noticed how the PC got caught, but nothing happened. I just stopped the vacuum and it just released by itself, not even hitting the reflux button. So I decide, okay, a few fibers left is no big deal. Decide against continuing this, come out, and then under hydroimplantation I am injecting this single piece hydrophilic lens. These lenses are very easy to inject, and they go straight into the capsular bag. I then put in my intracameral antibiotic and hydrate the wounds and conclude surgery. Thank you so much for watching.